Hello students, today we are going to learn about AIDS. What do we mean by AIDS? What is its causative organism? What are the causes and what are the preventive measures? This all we are going to learn in this video. AIDS is acquired immunodeficiency syndrome. Now, acquired means which we have acquired after our birth. That means which we have acquired afterwards. Immunodeficiency is deficiency of immunity. So in this deficiency of immunity is acquired and it is a syndrome. What is a syndrome? Syndrome is a combination of diseases. Like there is not a single disease in this, it's a combination and there are multiple symptoms of this. That's why it is called acquired immunodeficiency syndrome, AIDS. And this AIDS is caused by HIV. What is HIV? HIV is a virus which is human immunodeficiency virus. So the causative organism of AIDS is HIV. And HIV is a retrovirus. Retrovirus is the virus where the genetic material is RNA. Now, how this transmission of HIV occurs? The transmission of HIV from an infected person to a healthy person can take place by sexual contact, unsafe sexual contact with the infected person. Number two is sharing of infected needles, as in the case of intravenous drug abusers. These drug abusers, they inject the drug, they take the drug with the needles, with the help of the needles, and they sit in a group and they share these needles. So they get this infection. And then transfusion of contaminated blood. When suppose for any surgery or any other problem, the blood is required and that blood is contaminated with the HIV virus, then there is this transmission occurs. And then fourth is infected mother to child through placenta. If the mother is infected, the child can get this through placenta. So these are the causes where time lag between infection and appearance of symptoms. It can be few months to many years, and this is called window period. The person is infected, but the person is not showing any symptoms. Slowly and slowly, the immunity deteriorates, and one stage comes when the person can die because of simple cold, because there is no immunity left in the person's body. So this period between the infection and the appearance of symptoms can be for many years at a stretch, and this period is called window period. Now, how this AIDS infection spread? AIDS virus, that is HIV, it enters our body and it enters into macrophages. Macrophages are the cells where it enters. Now here in this macrophage cell, the virus replicates. Viral RNA first reverse transcribed to viral DNA. From DNA to RNA, it is transcription, and from RNA to DNA, it is reverse transcription. So viral RNA is reverse transcribing to viral DNA. Now this DNA will get incorporated with the host DNA. That means it will get incorporated with the DNA of the human cell, and subsequently new viral particles are produced. So the cells of human cells will become the factories to produce this virus, because the DNA of this virus get incorporated with the DNA of the human cell. See, this is how it happens. This is the retrovirus. Now this retrovirus is having RNA as the genetic material, and this is a protein coat. Now when this viral RNA infects a cell, which is a normal cell. This is a normal cell, and this will get into it. The RNA will get into the cell. So viral RNA is introduced into the cell. This is the animal cell. Now this viral RNA will undergo the reverse transcriptase. Reverse transcriptase is that this RNA will produce DNA. So this is DNA is produced by reverse transcription, and this DNA will get into the nucleus and will get incorporated with the host genome. This is the human DNA, and this viral DNA will come and incorporated with the human DNA. And then this new viral RNA is produced in the infected cell. What will happen from here? The DNA will get converted into RNA by transcription. So messenger RNA will be formed and the viral RNA will be formed. And this viral RNA will form protein and new viruses are produced. So this cell will become a factory for the viruses. And then these viruses will come out of the cell and then again go and infect other cells. So slowly and slowly, these viruses will keep on infecting many cells of the human body. So macrophages become a virtual HIV factory, and thereafter HIV enters helper T lymphocyte. When we had, you can refer the video on immunity, we had discussed that there are B lymphocytes and T lymphocytes. So T lymphocytes are the helper cells, and these HIVs are entering into the T lymphocytes, and they replicate and they produce their progenies. So as the progenies are released, they attack other T lymphocytes. So slowly and slowly, many T lymphocytes are getting attacked by this virus, and slowly they will start damaging the T lymphocytes, and the number of the T lymphocytes will start decreasing. And because of the decreased number of the T lymphocyte, the immune response of person also becomes weak. There is no immunity or very weak immunity left with the person, and slowly this get aggravated and the person can die of a simple cold. So even infections which could have been overcome easily, a simple cold, simple infection, the person can die. It becomes aggravating, and it becomes lethal in case of AIDS patient. And how can we diagnose this AIDS? The diagnosis is by a test which is called ELISA test. And ELISA is enzyme linked immunosorbent assay. So this is the test for diagnosis of AIDS. Now, there is no permanent treatment. Again, there is no vaccine yet, but the antiretroviral therapies are there. Antiretroviral medicines are there, which can prolong the life of the patient. For these days, the AIDS patients are surviving well, and they are surviving for long also with the help of this treatment. But otherwise, there is no permanent cure. Now, prevention is the only method. When there is no cure, prevention is the only method to cure. So ensuring use of disposable syringe. Whenever you are going for any test, whenever you are going for any injections, please make sure that the syringe which is used on your body is disposable. It should be a new syringe. The nurse, the medical assistant, or the doctor should open it in front of you. It should be opened in front of you so that there is no chance of any contaminated syringe being used on your body. Number 2, the blood which we are taking from the blood banks should be screened. We should make sure that that blood is not contaminated with HIV virus. Though blood banks are taking utmost care that it is not, but still, if you require it for you or your family member, please be doubly sure that this blood which you are taking from the blood bank is not contaminated with HIV. Then you have to advocate safe sex. Safe sex is the sex when the physical barriers are being used, the condoms are used, where there is no mixing of the liquids of the two partners. So the safe sex should be advocated, because safe sex ensures that there cannot be any infection from a infected partner to the healthy partner. The NACO is what? NACO is the National AIDS Control Organization of our India, and many NGOs. They are doing a lot to create awareness among people regarding this AIDS. The different advertisements are there. They are using the social media. They are using the print media to ensure that people are aware about the causes and the preventive measures, so that it can be stopped. And the good news is that the numbers are now decreasing, but still there is a need. And 1st of December is the World's AIDS Day, and that day we wear that red ribbon in solidarity, so to show the solidarity for the AIDS patients. So this is about the AIDS.